Just want to thank everyone for coming out and getting testing. Incredible numbers in the last 24 hours, and also the vaccinations. Can I ask the public just to be patient? We know that there's long lines at our testing clinics. Please regularly check the website as we are expanding the hours of centres, and also in Townsville we'll be setting up a second site today as well. We've got 8 lanes running at double staffing capacity at 1,300 smiles in Townsville, we've got QML have established a private drive-through at JCU with 3 lanes and going to 4 lanes tomorrow. And we also, as I say, are looking at standing up an extra site. So we know in some areas, particularly Townsville, and we thank all the people in Townsville coming out and getting tested, there has been long lines. Also, I had reports this morning that some of the public waiting to be vaccinated, and particularly at the Sunshine Coast vaccination site, were becoming abusive of our staff because they wanted to be assured that they'll be able to get their second vaccination with shortage of supply. Can I ask the public to be respectful to our staff who are working tirelessly to get Queenslanders vaccinated? And whether it's testing staff or vaccination, we are so grateful for our health workers and what they are doing each and every day. They don't deserve any abuse in the roles that they're undertaking. We know people are anxious. We know people want to get tested and vaccinated. We respect that, but we also want you to respect our workforce and what they are doing to keep us safe. In relation to the investigation, in relation to the individual working outside of a COVID ward unvaccinated, we've appointed Dr Paul Griffin, who is the Director of Infectious Disease at Mater Health, to lead the investigation. He will specifically be looking at how it came to be that this individual was working where they were unvaccinated. In doing that, he will also be looking at the systems that are in place at that hospital to determine who is a worker that must be vaccinated to work in those areas, and who deems that area as being a mandatory vaccination area or not. Obviously, that work will start immediately, looking at the systems and the processes for the decision-making. It will be some time before any interview can be done with the individual herself, because we are very mindful that she is a COVID-positive patient in a COVID ward currently, and we must respect that her health care comes first, but that will not delay the other work that can be done in the investigation. I can also advise that letters are going out today to our 5 hospitals that manage COVID patients. So this is the Cairns Hospital, Sunshine Coast University Hospital, Gold Coast Hospital, RBWH and the Prince Charles, asking them, based on what we now know with the new variant, and particularly Delta, and it's how contagious it is, asking them why we shouldn't expand our mandatory vaccination group to be the entire hospital staff where there are COVID wards, to overcome the issue of trying to define who is and who is not working around a COVID ward. Every time we have had transmission, we have looked at how we can improve our processes. Every jurisdiction has done this that has had an outbreak, whether in hotel quarantine or in our hospital system, to learn the lessons of what we can do better, but also to look at the changing nature of these variants and the risk profile. We know the risk profile has gone up. We know we need to do even more to protect our health workers and our community. I'm very mindful that tens of thousands of health workers around the world have died, have been infected while doing their job. We have been very, very fortunate that very few have been infected in doing their job here in Queensland, but we can't relax and we can't become complacent. We need to do more. What that means is we are wanting to investigate the risks of the catering staff in the kitchen handling any equipment that might come out of a COVID ward, the laundry people, and what sheets and other fabrics might come out, or towels might come out of the COVID ward. The pathology staff who are managing all of the swabs. So we want to have a much broader look and a much broader definition of who is our 1A workers who are potentially at risk in relation to any contact with COVID positive patients. So we'll be writing to them today. I've already spoken to, met virtually with other stakeholders, the AMA and ASMOF and all the unions, both yesterday and the day before, to flag the expansion of our mandatory vaccination group, and have spoken to them also about the potential that these 5 hospitals that manage COVID patients are all requiring vaccination. So we'll work with all those stakeholders in the hospitals to ensure that we put in place the best methods we can. We must remember that health workers across the country are not mandated to be vaccinated. National Cabinet has not mandated any group other than aged care workers to be vaccinated. Now, despite this, we had already mandated anyone working in hotel quarantine or around COVID patients to have to be vaccinated, but we want to do more, knowing that this Delta variant is so contagious and is going to put more people at risk. In relation to the queries around the Commonwealth's request for people under 40 to get vaccinated by AstraZeneca and to consult their GP, I know there was some commentary yesterday about whether it was just GPs that were going to be consulting under 40s. My understanding, based on information that was sent to us by the Office of the Coordinator General, National COVID Vaccine Task Force, is that they were opening up access to primary care sites. So we read this as Commonwealth sites as well, and I understand the clinic finder includes Commonwealth vaccination sites. So we do just want to make sure that anyone going to those Commonwealth sites are going to have the opportunity to talk to a medical physician and be able to have that conversation around informed consent as well. If they're going to other primary care sites that are beyond GPs, and it specifically says we're preparing advice on the changes to send directly to GPs and other primary care providers. So we just want to make sure with the Commonwealth that if under 40s are requesting AstraZeneca to other primary care providers other than GPs, that they are making sure that they're getting that informed or that advice for informed consent.